The long journey of drug development ultimately leads to one final destination: regulatory approval. Yet, all too often, projects strike an unexpected wall of data deficiencies just as the finish line comes into view. Can you say with absolute certainty that your clinical trials data quality is flawless? Today, many sponsors face invisible data risks, fearing that years of dedicated effort may suddenly vanish into thin air. PointPath.Biz is a team of experts dedicated to visualizing these hidden risks and guiding your project towards successful, guaranteed approval. The price of neglecting data quality. Deficiencies in the data management process are not merely minor operational hiccups. Rather, they can escalate into catastrophic risks that threaten the very survival of your business. Research indicates that just a single day's delay in approval can result in lost revenue opportunities of up to $500,000. A delay of several months translates directly into hundreds of millions of dollars in losses. Even more critical is the erosion of statistical power caused by data noise. It is the ultimate tragedy in drug development when a drug that should have been effective is judged to have no significant difference simply due to poor data precision. Furthermore, non-compliance with 21 CFR Part 11 or gaps in audit trails can lead to the worst-case scenario: the complete invalidation of your trial data by regulatory authorities, resulting in a flat rejection of your application. We've outsourced the operations to a reliable CRO, so we're safe. This mindset is now a thing of the past. The latest international guideline, ICH E6 R3, reinforces a critical point. Even when tasks are outsourced, the ultimate responsibility for data quality and integrity remains 100% with the sponsor. Regulatory authorities no longer just scrutinize the data points themselves. They place immense weight on the evidence of how the sponsor exercised oversight over the entire process. Simply accepting deliverables from a CRO as is makes it impossible to demonstrate that you have fulfilled your oversight responsibilities. It is essential for sponsors to possess professional DM expertise, the ability to engage in high-level discussions with the CRO, and rigorously evaluate every deliverable. In the world of quality management, there is a fundamental principle known as the Rule of 10. A mistake that could have been prevented during the protocol design phase will cost 10 times more to fix during the trial. If you attempt to rectify it during the final query stage just before database lock, that cost and the time required skyrockets to 100 times the original investment. Furthermore, if corrections are forced after data freeze or triggered by regulatory findings after submission, the resulting costs and delays become astronomical. In the worst-case scenario, it can lead to the outright termination of the project. Instead of being consumed by firefighting in the downstream processes, invest in fire prevention at the upstream stage. This is, without question, the smartest and most economical strategy. Our strategy, Risk Mitigation Solutions by PointPath.Biz. This is why PointPath.Biz proposes a unique, strategic approach. We engage as data experts long before operational management begins, starting right at the protocol synopsis phase. We ask the critical questions early on. Can this endpoint be accurately captured via EDC? Is the data structure robust enough for statistical analysis? Are we placing an undue burden on investigators and site staff? We rigorously validate CRF items and structures from both scientific and technical perspectives. By planning external data integration and QC strategies at the absolute upstream stage, we eliminate the seeds of future trouble before they ever have a chance to sprout. What we offer is not merely a formal progress check. We work alongside you build a data quality system that you can present and defend with absolute confidence to regulatory authorities and partner companies. To achieve this, we employ 4 rigorous approaches. 1, the identification of critical data, defining the essential data points that determine the success or failure of your trial. Point 2, RBQM support, implementing dynamic, risk-based quality management that prioritizes resources where they matter most. Point 3, clinical trial oversight, monitoring operational trends with the professional's eye to ensure compliance. Point 4, incident and deviation management, capturing near misses and managing deviations to prevent minor issues from becoming major crises. PointPath.Biz provides robust validation support to ensure that your systems never become a burden to your project reliability. We stand guard over 3 essential pillars. 1, ensuring data integrity, guaranteeing that clinical trial data is accurately recorded, stored, and extracted without being unintentionally altered or lost. 2, verifying intended system performance, thoroughly validating that the system operates exactly as defined, preventing any adverse impacts on the trial caused by bugs or malfunctions. 3, Accountability to regulatory authorities. Maintaining a state of constant readiness where reliability can be demonstrated at any time based on objective, verifiable evidence. Protecting data quality. Accelerating development. Balancing speed and quality is the fundamental value PointPath.Biz promises. By integrating deep data management expertise into your team, we foster not only peace of mind, but a healthy professional tension and true collaboration with your CRO. We move beyond mere complacency, creating an environment where professionals challenge and elevate one another. The resulting data integrity is what propels your clinical development to the next stage. Are you ready to innovate globally? Here to guiding your path to success.